Welcome, everybody, to the Coe and Shame Veterinary Podcast. I am your host, Dr. Randy Roark. Guys, I got a good one. What if I told you that I know how to increase job satisfaction in your practice? I know how to reduce the chances of people deciding to leave. I know how to increase psychological safety and make people feel better about your culture. I do, because of my friend, Dr. Jason Coe, who's got some new research. He's talking about relational coordination today and some of the new research he put out in the Journal of the AVMA. We get into this, obviously, when you start the episode, but just to lay it out, relational coordination is how the different roles inside your practice are communicating with each other. So this is, how are the doctors talking to the techs? How are the techs talking to the assistants? How is the front desk talking to the kennel staff? How is the kennel staff talking to the doctors? That's relational coordination. Is, do we have a system? Do we have cadences? Do we have electronic communication? What are we using to talk to each other? And what does that look like? And what are the expectations around communication? And so Dr. Coe's got some research out on the impacts of relational coordination and what it does in practices and what it means. And I'll let him lay out more of that. But this is one of those episodes that I could have kept going for another half an hour really easily. I got a lot of questions. I think it's fascinating that this is being rapidly studied in about 70 other industries. And so Jason can say, hey, Andy, we don't know that in vet medicine. In other industries, this is what we're seeing. And so that's kind of my hypothesis right now. And so anyway, just really cool stuff about how we communicate and the ways that we communicate. My goal with this, guys, I want vet medicine to be the best profession it can possibly be. I want people to enjoy their job. I want to have high job satisfaction rates across vet medicine. I want to have people who want to stay in the profession. I want people to feel good about the work they do. And I believe that if we address those sorts of things, we can improve medical quality, we can reduce medical errors, we can improve the client experience. I just think there's a lot of good that's possible in the world. And when I think about things that I'm excited about and think about things where, man, we can turn some dials and we can make some steps. And I think that we can really continue to improve medicine, not just for the pets, not just for the pet owners, but importantly, for the people who are practicing medicine. I get excited about that stuff. And so anyway, that's what we're talking about today. Let's get into it.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Coe of Shame with Dr. Andy Roark.
Welcome to the podcast, Dr. Jason Coe. How are you?
Good. Thanks for having me back, Andy.
Man, I love having you back. First of all, for those who do not know you, you were on the faculty at the Ontario Veterinary College. You are probably the premier researcher of the social side of veterinary medicine. You have as close to a standing column in JAVMA of anyone I know. Like every issue, the Journal of the AVMA that comes out, you have new research in. And so you are very a prolific researcher and publisher. And I love getting to talk to you because obviously the social side of vet medicine is something that's important to me. My focus very much has always been on helping people enjoy vet medicine and to build teams that are fun to be a part of so that people feel good when they go to work. And so you've got some new research that came out quite recently, and you've sort of been focusing on what you call relational coordination. So you've laid relational coordination down as a potential correlate to a lot of other sort of positive parts of workplace culture. And so let me stop talking here about this and let me turn it over to you. So talk to me a little bit about relational coordination and sort of what that means.
Yeah, no, appreciate that. And Andy, I think you and I come from a similar sort of drive in terms of the work that we do. Really, for me, is about what can I do to support the veterinary profession? And so this is work that I wanted to do probably for the last 2 decades, and excited to have this opportunity to have now published a study and now be here talking to you, where we really took work that was first established in the airline industry in the 1990s, moved into human healthcare, has now being looked at in probably over 70 different industries. And we thought, well, why not look at it in veterinary medicine? Because it's a different way of looking at teams, where it's looking at the coordination of interdependencies between roles in delivering interdependent tasks. And I use that very specifically in that it's looking at the role and how roles work together rather than actual individuals, which I think is a big difference in terms of thinking about veterinary practice and how do all the different roles within a practice work together to accomplish the work processes and the outcomes we're after. And so relational coordination is really looking at a work process that is built off of two dynamics. One is the communication dynamic and another is a relational dynamic, and how those kind of intertwine between the roles that work together to achieve those outcomes.
So when I'm looking at this, what I'm taking away is the idea, basically, when we talk about relational coordination in the vet context, we're talking about how does the practice manager talk to the technicians? How does the doctor talk to the technicians? How do the technicians sort of talk to the doctor? And it's very sort of role-based, right? As opposed to this is how technicians communicate with each other, or this is how well the doctors know each other. This is specifically across different roles in veterinary healthcare, right?
Yeah, it's across roles, but it's also within roles. So how do veterinarians communicate as well? And so the difference is it's not looking at how you and I, Andy, are working together or communicating together. It's looking at how our roles are together. So both veterinarians would be looking at how do we coordinate as veterinarians in delivering patient care. And then it would look at other roles. And so in the publication, we have a figure, I think is figure 1, which is a relational map. And it really exposes the complexity of those interdependencies within a veterinary practice just by looking at all the crosses and connections that go on within a veterinary practice. So extremely complex, but for me, very exciting because it really provides this opportunity for us to look at where is it working within those roles? Where are there opportunities to enhance the communication, which really breaks down to frequent, timely, accurate problem-solving communication, as well as the relation between those roles, which is very focused on shared goals, shared knowledge, and mutual respect, which we can both probably appreciate is going to be core to any highly functioning team.
Yeah. So imagine that you and I walk into a veterinary clinic, and let's say that this clinic has a very poor relational coordination score. What does that look like? What are the behaviors that we're seeing? What are the things that you and I would notice immediately in a particularly low relational coordination practice?
Yeah, that's an interesting question in the sense of it really comes back to the communication. So we're probably seeing breakdowns in communication between the front of the practice, the back of the practice, but even within sections of the practice, it really depends on where those relational coordination scores maybe are lower, as well as the relational component. So it would be a team that are working for cross purposes. They have different goals. They don't have systems in place to share information in a timely fashion, and there's some hostility. And so, you think about the toxic work environment, that would be what we would see, and it would result in low relational coordination scores. And so the way that this works is as we measure these, we can start to pinpoint some areas that are opportunities for us to focus on as a practice team to strengthen some of those ties. So might be a tie between veterinarian and someone, the kennel staff, or wherever it might be, where those ties are, that we can really support the team to improve the communication and the relationships there.
So flipping this over, give me some examples of the behaviors or the systems that would be in place in a really high functioning, high relational coordination practice. Like you said, the doctors and the kennel staff are communicating well. Like in your mind, what does that mean? Does that mean we know each other as people? Does that mean that we have a good system for communication? Like when you think about practices that have excelled or behaviors that you think would be exemplary, what are some of those examples of things that you might see that would be exceptional examples of relational coordination well performed?
Yeah. So when I think about relational coordination, what we found in some of our work is that frequency of communication tends to be in the higher end in terms of the connections between those different roles, yet timeliness of it. And so I think about practices in implementing different strategies for making sure that the communication between one role and another role that are interdependent in delivering that patient care have for sharing. And so electronic medical records would be an example where I can type in something that I've either done or something that's happened, and someone in another part of the hospital that is also connected to that patient's care can pick that up. I know other practices are using different messaging apps or functions to have that communication. And so that would improve the timeliness of that communication. Another might be thinking about how we can have really short but impactful rounds. And so this might be going and sharing what's happening with the patient and making sure we're drawing in the people that are all connected and need to be in the know. And so it's even thinking about who's going to be discharging this patient who might need to know some information in relation to that we may not have thought about as the team that delivered the care or the surgery, that kind of thing. And so it's having impactful rounds so we can all get on the same page. So we're all working towards the same goal or outcomes, which happens as a result of that communication and making sure it is frequent, timely, and then accurate, right? In terms of making sure we're getting the right message across.
So talk to me a little bit about the survey research mechanism that you put together and how you started to look for relational coordination and the other factors that you kind of looked at in tandem with it.
It's a licensed product in terms of a survey, and it really is asking the 7 questions in terms of you develop or identify a work process. And ours was really very general in this study and looking at the delivery of veterinary care. And then, I as a veterinarian would fill out that survey, but it would ask me in terms of frequency of communication, how would you rate that in relation to the 13 other roles that have been identified within your practice? And then we'd ask that same sort of question for timeliness, accurateness of communication, the problem-solving nature of communication, and then the 3 relational. Do you have shared goals with each of these 13 other roles? What about shared knowledge and then mutual respect? We then take that, it gets mixed up into a formula that produces different scores. So you can get an overall hospital score in terms of relational coordination. You can get them based on each of those 7 dimensions. So you can see which ones maybe are higher and which ones are lower, where we can focus on the lower to try and bring those up. And then you can also look at, again, to tie that complexity between the different roles to see, is there a place within the hospital that things are working really well and maybe we can learn from that and apply to other areas? Are there areas that we need to support? So we did that. And in this study, we went out to work with a corporate group that we've been working with for a while, VCA Canada. We had invited all of their employees to participate. We didn't end up getting the numbers in each hospital to be able to look at a hospital level. So we ended up looking at it across the organization at an individual associate level, which what it allowed us to do was just start to understand how someone's perceived relational coordination in their practice impacted things like their assessment of the psychological workplace climate, their job satisfaction, as well as their intention to leave. And we saw positive associations with their evaluation of the workplace psychological climate, positive association with job satisfaction. And we saw an association where people indicated less intention to leave when their relational coordination scores were higher.
So how strong a correlation do you see here when you talk about the psychological climate? To me, that's sort of workplace culture or positive practice environment, things like that. And the intention to leave your job or just general job satisfaction. Like, how strong a correlation do you see between this relational coordination and the style and the frequency of communication with those types of satisfaction metrics?
Yeah, I appreciate that. I think we all want to work in an environment where we feel psychologically safe, right? And so when we looked at this, person's perception of relational coordination had quite a strong association or odds of them identifying a positive psychological work climate, similar with job satisfaction and retention. And so when we look at this, and we shared, our work with a epidemiologist, a statistician, and they said, these are quite strong associations you're finding here, which I think is really encouraging in terms of the work that we can do to support veterinary practices in this area of how we, as different members of the practice and different roles, can work together to really deliver on the outcomes that are important to us, right? In terms of the team, the individuals within those teams, but also our clients and our patients.
Is it possible that when you have a practice that has like a strong psychological safety culture, they naturally communicate more effectively or more frequently? Like if I'm surrounded by my friends, I talk to them a lot more. I don't have friends because I talk to people a lot more, but because I have these friends, I communicate with them more. It's sort of a chicken and egg correlation is not causation. How do you start to sort of tease those things apart? Or do you believe that laying in these types of communication structures, this communication cadence, setting communication norms around roles, do you think that's integral in the creation of that type of psychological safety?
Yeah, it's a great question. And I think what I can say from the study we did is it's cross-sectional, so we can prove causation. And to your point, as a psychologically safe environment resulting in people's perception of relational coordination being higher, I'm cautious to say there's a causation because it was a cross-sectional study. I think that's the next piece of work that we're doing to track over time, what is a practice's relational coordination? And that's where in our next stage of research, we really want to get high uptake within a practice so we can really look at the relational coordination within that practice, identify some opportunities, work with that practice with a tailored plan on how to enhance those areas that have been identified with this tool, and then measure it again. And then I think through that process where we follow this over time, we make tweaks and see relational coordination go up. We can also measure the psychological and the safety environment, the psychological safety environment to see if that goes up. And so that'll be a much better way of kind of assessing that as our next step of work. Yet what I would say is if we look at those other 70 plus industries that this had looked at, this is not sort of a new idea that we're, piloting for the first time, looking at in veterinary medicine, I believe, for the very first time. Yet there's lots of work that's being done in other industries to see how they can work within those groups that have a targeted focus in terms of the work process to enhance that. And based on that work, I would assume or believe that, yes, as we improve relational coordination, we will see that improvement in workplace psychological safety.
It makes sense, right? I can't make you be friends with the people that you work with. I can't make you trust anybody, but I can lay a groundwork and start to build some systems that make sure that you're well informed about what people are doing and why they're doing it this way and what decisions are being made, and making sure that you don't feel like you're being set up to fail. I mean, all of those things, right, are going to come around and facilitate those types of relationships that we want to have. When you look at this, you mentioned, I think you said like 17 roles. Is that what you said across the hospital?
So we looked at 14 different roles.
So when you look at the 14 different roles, are there certain relationships that are more influential around creating sort of the psychological safety or the positive environment? For example, and again, this could be totally wrong, but I could see a situation where you say, well, in practices where the veterinarians and the practice manager communicate frequently, we tend to see a significant impact. In practices where the front desk and the kennel techs communicate frequently, less so of an impact. That seems to be a weaker relationship as far as overall job satisfaction or psychological safety in the team and things like that. Do you think that there is a difference? Are certain relationships more powerful in creating the benefits than others? And I'm asking that just because if I had a practice and I say, boy, I want to work on this practice, are there certain role relationships that might be worth prioritizing as we really start to improve the culture in this clinic?
Yeah. And that's a really important question, Andy. I'm very cautious and our team's very cautious about generalizing to say that this role relationship is one that we really need to focus on in every veterinary practice. And I think that that's the richness that this idea and the tool of relational coordination offers, is that we can look at it at a practice level. So we can work with the practice, use this almost as a diagnostic tool, which will help us understand the role relationships within that unique practice, which allows us to really pick out where do we want to invest our energies and time in helping support bring those up, which I think is a much more effective approach than a blanket sort of approach in relation to that. And we've been very cautious, even within the review of our paper, that question was asked, and we were very cautious not to highlight, well, that's what this means for all veterinary and those kinds of things, right? But I do think, it's a really important question because that's really what we're trying to achieve. And I do think it comes down to the individual practice, what gets me excited in the work we're moving forward to is how can we use this as a diagnostic tool at an individual practice level to support that practice and making some focused adjustments to really enhance how they're working or coordinating as an overall team.
When you put this survey together and you work with a single corporate practice group, so VCA Canada, is there any reason to think that your findings or approach would be different if this were sort of taken down to a single independently owned practice? Is there anything that you think maps well because it's a larger corporate environment that wouldn't map into an independent, smaller practice?
Yeah, that's a fair question. And you're really sort of acknowledging one of the limitations we did highlight in this study, in that it was a very defined practice group that may not operate as other corporate practices or even private practices might operate. And so that is something to take into consideration. And so I share that partly in that people should think about the findings of that paper and how they interpret them in relation to their practice. I don't think it takes anything away from the opportunity that relational coordination offers to any other corporate practice or any other individual private practice, and being able to look at how are their teams working together? Where are the opportunities? Where are things working well? Because I think there's so much we can learn from the things we're doing well to try to move into some of those other relationships. And so I do think that we do need to be cautious with our interpretation of the findings in that paper, yet the opportunity applies to all.
Well, I think it makes a lot of sense too. When we talk about, say, VCA Canada specifically, that's a group that's been around for quite some time and they're part of the Mars organization. And so I think the assumption from the outside would be that they've probably got some infrastructure that some independent practices or smaller or younger corporate groups wouldn't have. I think it's an interesting group to look at as far as systems and what creates these types of positive atmospheres and stuff like that. So I do like that a lot. Jason, when you think about this research, what is the question you're most interested in asking going forward? Like, if there is a question that you think this is the one that I would really like to know the answer to, what are you hoping for in the future in that regard?
Yeah, I just see so much potential in this idea of relational coordination and knowing that there is a way to measure it. And so the next piece for me is how do we bring it down to that individual practice level? It may also almost be a case study or a case series, right? Where we take practice, we look at it, we see how we can support that practice and kind of help them move the needle on whatever. And I think that's a big piece of the next step too, is that, as a researcher, sometimes we sit back and we develop a project and we go in and we ask, would you mind if we do this project? We get permission and we run it. I really see the next step being that collaborative piece, working with practice to identify what is it that's important to them. Let's assess these. What are the things we need to tweak? How do we help you create a plan to make those tweaks so that you're involved in the process all the way through? It's not just us coming and using this research lens to tell you what we think we need to do. It is really about building a relationship and doing it at an individual practice level so that we can create a model ultimately that then could be passed on to other practices, whether corporate or independent. And that model can be used to identify within my practice, where are some opportunities, right? Where are some of our strengths? Where are some of our opportunities? And then having a suite of things that can be used to help really address some of those opportunities or support some of those opportunities that are identified. And I think it's not the big study, it's the little study, but I think that little study is going to have the biggest impact.
Yeah. We live in a world where vet medicine is changing right now. And so there's definitely an increased focus on operations and metrics and revenue in a way that maybe it wasn't as clear a focus on that in the past. When I look at your results here and I look at the psychological climate and job satisfaction and the intention to stay in my current job, to me, it seems like those types of factors would probably correlate well with a practice revenue. Meaning, if I have a practice and my employees are generally have high job satisfaction and low intention to leave, in my experience, those tend to be practices that do financially well, and it's amazing how when you take care of people, they kind of take care of the business. And so can you comment on that at all? Has there been any looking at what relational coordination does line up with practice revenue, any sort of operational metrics as well as just sort of employee satisfaction?
So what I can say is we haven't looked at it in veterinary medicine, but we're going to look at that in veterinary medicine. That tends to be the question we're asking. It's not even just going to be financial metrics. We want to start looking at patient outcomes as well in relation to that, because the work that's been done in human medicine suggests that relational coordination can have an important role in all of that, including reducing cost, increasing efficiencies, which all tie back into the practice management side of things. And so there's good work there that we can look at, kind of help inform and support us to move faster probably than they did in some of the industries as they kind of explored their way through that.
I mean, to me, I'm interested in this in terms of medical quality, in terms of maximizing or optimizing patient outcomes, avoiding medical mistakes, reducing medical errors. It's an exciting lens to look at how we sort of practice medicine and how we take care of pets and people.
And one of the projects we have going on right now is looking at relational coordination in the context of culture of safety. So patient safety, but also associate safety. So, those are important outcomes as well. And so we have ideas on how we're going to look at a bunch of other things, and I expect we'll have many more publications in this realm over the next little bit. To your point, profession's changing quickly. So also staying kind of step with that as well. Yeah, I think with those changes, relationships still need to be at the core. And so it's going to be a fun place to be as we sort of navigate those changes.
Well, I'm an optimist just at heart, and I love the vet profession. I love vet medicine. I think that there are some corporate groups that have done a great job in establishing a good culture and that are working really well as far as building communication systems and relational coordination. And I think that some of these groups can do really great things for our profession. And so the idea of teasing out what is beneficial and what are the systems that are really helpful, I just think that that's just important work for where we're going, Jason, and kind of how the profession continues to shape up and how we take care of our people and how we take care of our patients. So Thank you so much for being here. Jason, where can people find you online if they're really into this and they want to make sure that they see the research you have coming out? What's the best place to find and stay up to date with that?
Yeah. So in terms of staying up to date, we're very active on LinkedIn. So Relationship Centered Veterinary Medicine at the Ontario Veterinary College. Anytime we have something to share, we're putting it out there first to share broadly. So if you want to keep your finger on the pulse of the activities we're doing, looking at the social side of veterinary medicine, probably the number one spot to go. We also have a website for our lab, which is www.rcvm.uofwealth.ca. And so that's another place where we're housing all of the information, including resources and tools that we're developing from our research to help support the veterinary profession. And so I'd say those are the two big places I would orient people towards.
That's fantastic. I'll put links in the show notes for everybody. Jason, thanks so much for being here. I look forward to seeing where your research goes. I look forward to having you back on the show to talk in the future about kind of what you're finding and how this is coming together. Thanks for being here, guys. Thanks for tuning in and listening, everybody.
Thanks for having me, Andy.
And that's what I got. Guys, thanks for being here. I hope you enjoyed it. I hope you got something out of it. Thanks to Dr. Jason Coe. King, if you enjoyed the episode, please leave me a review wherever you get your podcast. It's how people find the show. It always means the world to me. And guys, that's all I got. That's all I got. Take care of yourselves, everybody. I'll talk to you later on.